Becker Muscular Dystrophy, we call it BMD for short, is a problem someone is born with. It makes muscles get weaker over time. This can make everyday things harder to do. Physiotherapy or physical therapy is really important for managing BMD. It helps keep your muscles strong and flexible so you can do things on your own for as long as possible. It's all about having a better life if you have BMD. BMD is a kind of muscle disease. It mostly affects boys. It happens because of a problem with a gene. This gene makes a protein called dystrophin. Dystrophin protects muscles. Without enough dystrophin, muscles get weak and break down over time. Usually, you start seeing problems in late childhood or when you become a teenager. Early signs are trouble running, jumping, and climbing stairs. Muscle cramps and feeling tired are also common. As time goes on, walking gets harder, and you might need help with everyday things. Doctors use a few ways to figure out if you have Becker Muscular Dystrophy or BMD. This process involves a combination of clinical evaluations, family history assessments, and various diagnostic tests. They'll check how your muscles are weak and if anyone else in your family has it. Family history is crucial because BMD is a genetic disorder, often passed down through generations. Understanding your family's medical background can provide important clues. Blood tests are important. They check for something called creatine kinase or CK. CK is an enzyme that leaks out of damaged muscle cells into the bloodstream. Elevated levels of CK can indicate muscle damage, which is a hallmark of BMD. CK shows up in your blood when muscles are hurt. High CK means there's muscle damage. This test helps doctors understand the extent of muscle injury and can guide further testing. A genetic test looks at your genes to see if you have the problem that causes BMD. This involves analyzing your DNA to identify mutations in the dystrophin gene, which is responsible for the condition. Genetic testing can confirm a diagnosis and help with family planning. Doctors might also do an EMG. An EMG, or electromyography, measures the electrical activity of your muscles. It helps doctors see how well your muscles and nerves are working together. An EMG looks at the electricity in your muscles. This test can reveal abnormalities in muscle function that are characteristic of BMD, providing further evidence for a diagnosis. Sometimes, they take a tiny piece of muscle to look at it under a microscope. This is called a muscle biopsy. By examining the muscle tissue, doctors can see changes in muscle fibers that are typical of BMD, and they might use an MRI to see how much muscle damage there is. MRI scans provide detailed images of muscle tissue, helping doctors assess the severity and progression of the disease. This comprehensive approach ensures an accurate diagnosis and helps in planning the best course of treatment. A physiotherapist or physical therapist will do some tests to see how BMD is affecting you. They'll ask you about your problems, your health, and your family's health. They'll watch how you stand, how you balance, and how you walk. They'll check how strong your muscles are and how well you can move your joints. They'll also see how well you can do everyday things like climbing stairs, getting up from a chair, and walking. They will check your breathing and your heart because BMD can sometimes affect those too. Physical therapy for BMD helps you stay mobile and do things on your own for as long as possible. It's a crucial part of managing your condition and maintaining your quality of life. Regular sessions with a physical therapist can make a significant difference in your ability to perform daily activities and stay independent. Your therapist will make a plan just for you. Strengthening exercises are important. These exercises are tailored to your specific needs and abilities, ensuring that you get the most benefit without overexerting yourself. They focus on building muscle strength, which is essential for supporting your body and improving your overall mobility. They help keep your muscles strong. Strong muscles can better support your joints and reduce the risk of injury. This is especially important for people with BMD, as muscle weakness can lead to further complications. Regular strength training can help you maintain your independence and improve your quality of life. Stretching helps you stay flexible and stops your muscles from getting tight. Flexibility is key to maintaining a full range of motion in your joints, which can help you move more easily and comfortably. Stretching exercises can also help reduce muscle stiffness and soreness, making it easier to perform daily tasks. Gait training helps you walk better. This type of training focuses on improving your walking pattern, balance, and coordination. It can help you walk more efficiently and with less effort, reducing the risk of falls and improving your confidence in your ability to move around. Respiratory physiotherapy helps you breathe better. Breathing exercises can strengthen the muscles used for breathing and improve your lung capacity. This is particularly important for people with BMD, as respiratory issues can be a common complication. Regular respiratory physiotherapy can help you maintain good respiratory health and improve your overall well-being. This might be breathing exercises. These exercises can include techniques like deep breathing, diaphragmatic breathing, and using specialized equipment to help expand your lungs. Consistent practice can lead to better oxygenation of your body and improved endurance for physical activities. Postural training helps you stand tall and straight. Good posture is essential for reducing strain on your muscles and joints, and it can also improve your balance and stability. Postural training exercises can help you develop better alignment and reduce the risk of developing musculoskeletal issues. Functional training helps you do everyday things. This type of training focuses on improving your ability to perform daily activities such as getting dressed, cooking, and cleaning. By practicing these tasks in a controlled environment, you can develop the skills and confidence needed to maintain your independence. Hydrotherapy, which is exercising in water, can be good because the water supports you. The buoyancy of the water reduces the stress on your joints and muscles, making it easier to perform exercises. Hydrotherapy can also help improve your cardiovascular fitness, strength, and flexibility in a low-impact environment. You might need things like braces or a wheelchair to help you move around. These assistive devices can provide additional support and stability, making it easier for you to stay mobile and independent. Your physical therapist can help you choose the right devices and teach you how to use them effectively. There are some new and exciting things happening in BMD research that give us hope. Gene therapy tries to fix the broken gene that causes BMD. This is showing good results. Corticosteroids can help slow down muscle damage. CRISPR technology is a new way to try to fix the gene. Stem cell therapy might be able to help grow new muscle. Better ways to take care of the heart are important because BMD can affect the heart. Things like fitness trackers and smartwatches can help you track how active you are, which is helpful for managing BMD. Here are some easy exercises you can do at home. Stretching is a crucial part of maintaining both strength and flexibility. It helps to keep your muscles long, lean, and flexible, which in turn helps prevent injuries. Let's start with some basic stretches that you can easily incorporate into your daily routine. Calf stretch. Stand facing a wall, put your hands on the wall, and step one leg back. Bend your front knee and lean into the stretch, hold for 30 seconds. This stretch is excellent for your calf muscles, which can get tight from activities like walking or running. Make sure to switch legs and repeat the stretch on the other side. Hamstring stretch. Sit on the floor with your legs straight. Reach for your toes. Keep your back straight and hold for 30 seconds. This stretch targets the hamstrings, which are the muscles along the back of your thighs. Tight hamstrings can lead to lower back pain, so it's important to keep them flexible. If you can't reach your toes, don't worry. Just reach as far as you can while keeping your back straight. Quadriceps stretch. Stand up, hold on to something, grab your ankle, and pull your heel towards your bottom. Hold for 30 seconds. This stretch is great for the quadriceps, the muscles on the front of your thighs. These muscles can get tight from activities like running or cycling. Make sure to switch legs and repeat the stretch on the other side. Wall push-ups. Stand facing a wall, put your hands on the wall, shoulder width apart, and step back. Lower your chest to the wall, bending your elbows, and push back up. Do this 10 to 15 times. Wall push-ups are a great way to build upper body strength, especially for beginners. They work your chest, shoulders, and triceps. As you get stronger, you can move to more challenging push-up variations. Chair squats. Stand in front of a chair. Lower yourself like you're going to sit. Keep your back straight. Stand back up. Do this 10 to 15 times. Chair squats are excellent for strengthening your legs and glutes. They also help improve your balance and stability. Make sure to keep your knees behind your toes as you lower yourself to avoid putting too much pressure on your knees. Bicep curls. Sit with your feet on the floor. Hold a small weight in each hand and slowly curl the weights up to your shoulders. Keep your elbows tucked in. Lower the weights back down. Do this 10 to 15 times. Bicep curls are a simple yet effective exercise for building arm strength. You can use small dumbbells, water bottles, or even cans of food as weights. Make sure to move slowly and with control to get the most out of this exercise. Talk to your physical therapist before you start any new exercises. They can help you choose the right ones for you. A physical therapist can also ensure that you're doing the exercises correctly to avoid injury. Remember, consistency is key. Incorporate these exercises into your routine, and you'll see improvements in your strength and flexibility over time. Stay active, stay healthy. Exercise is good, but be careful so you don't get hurt. Don't do too much. Listen to your body and stop if you feel pain, dizzy, or short of breath. Warm up before exercising and cool down after. Drink lots of water. Do the exercises correctly so you don't hurt yourself. Talk to your doctors and therapists regularly. Tell them about any changes or new problems. Follow their advice about medicines, therapies, and how to live a healthy life. BMD can be hard, but you can still have a good life with the right help. It's important to find out you have BMD early and start treatment quickly. Physical therapy helps you stay mobile, do things on your own, and have a good life. Learn about new treatments and research. Find support groups and online communities for information, help, and support from other people. You are not alone. With the right doctors, therapists, family support, and a positive attitude, you can handle the challenges of BMD and live your best life.